Well, hello, and welcome to this evening's broadcast. I'm your host, Eric Goldman, the editor of Holistic Primary Care, and I want to welcome you to this. This is our third in a series of weekly webinars on fall and winter seasonal support, supported by Emerson Ecologics. And for those of you who participated in last week's webinar, welcome back. And for those of you who are joining us for the first time, well, we've got a lot of good stuff in store. And so tonight we're going to be focusing on mood issues, especially during the fall and winter months. Seasonal affective disorder and other mood changes are very common in the winter season, as I'm sure you all know in your practices. And it's also compounded by the many family pressures that come with the holidays and all sorts of other things, back to school issues. And so there's a lot going on for people in the fall and winter. And so what can we do now to support patients and ourselves and minimize the risk of the winter blues? Our speaker tonight is Meredith Murray, who is the founding director of Source Natural Medicine in beautiful Exeter, New Hampshire, where they know a thing or two about cold weather, winter, and all that kind of stuff. She's also a graduate of National College of Natural Medicine in Portland, that's out in Oregon, where they also know a thing or two about dark, cloudy weather. So I think Dr. Murray's going to have a lot to share with us. She's a medical educator for Emerson Ecologics, which is the largest wholesale distributor of natural products in the US, specifically for medical practitioners. And here at Holistic Primary Care, we've had a long relationship with Emerson, and we are grateful for their sponsorship for this webinar series. So before I turn things over to Dr. Murray, just a few little logistical points. The slide set for tonight's presentation is available as a PDF handout. So if you look at your control panel there, you'll see a little tab down toward the bottom that says handouts. And if you click on that and open that, you'll see there's a PDF file in there. And all you have to do is click on that and it will download the PDF to your computer. So you don't have to take notes unless you're compulsive like me. But it's all in there in the slides. And we will be taking questions after the formal presentation. So if you'd like to submit a question, just open the little questions tab in your control panel and type the question. And we'll try and answer as many questions as we can in the allotted time. So with that, let me turn things over to Dr. Meredith Murray, and we're going to talk about mood support essentials for the winter months. So here we go.
Great.
Okay, hold on, let me find you there.
Mm-hmm.
Here we are. Okay, Meredith Murray, it's all yours.
Okay. Showing my screen. Everyone can, Eric, can you see it okay? Okay. Let's get going. So thank you for having me, Eric. I'm happy to be here and talking about fall and winter mood support. Just a little bit about what we're going to go over tonight. And as Eric mentioned, my name is Meredith Murray. I'm a naturopathic doctor. I'm part of the Emerson medical education team, and I also have a private practice. And so today we're going to be talking about seasonal mood changes, aka the winter blues, what is happening physiologically, why it's happening, and then what foundational products and different nutrients can be used to support mood specifically at this time of year. Moving a little bit away from products and nutrients and kind of talking about the whole person and other kind of non-oral type of support we can offer, and then general considerations when speaking to patients and clients about mood support and just actually, you know, working with patients in general. And then we'll open it up to questions. So just a little bit about the Ask the Expert feature or service that we have at Emerson Ecologics. Apologize if you were previously at these and you heard this before, but we have a service, myself and my colleague Lisa Murray, no relation, she's a dietitian. We answer practitioner questions about the thousands of products that we have, what products might be appropriate for certain clinical situations, how to find products that you might be, since we have such a vast array of products and brands, if you're looking for a specific formulation, we have a bit of an idea of how to find those for you. And then also we kind of guide people on if they're looking for a product and has a specific allergen they're looking to avoid, we can help narrow that down as well. So we do this through the website, the Emerson Ecologic website. On all of the products, we have an Ask the Expert link where you can submit an email. And we also take phone call appointments through the customer service. They will schedule practitioners to speak with myself or Lisa for 15 minutes to go over a case. Sometimes when we get an email, it brings up more questions for me clinically that I would like to talk to the other practitioner about. So it's kind of fun to kind of go through cases with other practitioners day to day. So yeah, so hopefully people will utilize it. So this is our topic at hand for today, addressing mood changes that happen at this time of year, specifically fall and winter, if you're in the Northern Hemisphere, I should say. And if you are in the northern part of the United States, which I'm assuming people are, you probably experienced that it's now darker and colder. Even a few weeks ago at this time, it would have been light out, and now, for me at least, it's pitch black. And so with that, there are some noticeable changes that people can experience in terms of mood and energy and overall well-being. And like Eric mentioned, I actually grew up most of my life in the Northeast, but it really wasn't until I moved to the Pacific Northwest for naturopathic school that I really did experience some of these seasonal mood and energy shifts. And once I was able to identify that and work with my practitioners there, it was manageable. But wow, it definitely is cold and rainy there. So with seasonal mood shifts, I mean, seasonal affective disorder is a diagnosed condition. It is in the DSM-5. It does have criteria that has to be met. But in terms of why it happens, one of the main hypotheses is that it has to do with how our daily routines are not in sync with the light and dark cycles, the circadian rhythm of the day. And so when you're in the northern latitudes, you're getting less sunlight, and that can affect the neurotransmitters in your brain. So for example, one of the theories is that they did a study and they showed that people who have low mood in the winter have more of something that's called the serotonin transporter. Not serotonin, but the transporter. And the transporter is in these people is more active in the winter, and it actually makes the serotonin less active. It kind of moves the serotonin back into the presynaptic neuron, so it's not as active. And so that can make people obviously feel pretty low. And that tends to happen more in the winter because sunlight actually makes the serotonin transporter less active. So when there's more sun, there's less transporter, and there's more serotonin to be used in the body. And then the other aspect is that it's thought to have to do with too much melatonin. And as we know, melatonin gets made and secreted by the pineal gland when the light goes through the retina and we sense that there's darkness, that kind of balance between light and dark. And so in the winter months, obviously, there's much more hours of darkness throughout the day. And so there's more melatonin production, and that makes people sleepier. And so it is thought that this combination of potentially low serotonin, elevated melatonin can cause these issues with the circadian rhythms. And then those who have this seasonal mood shift have a harder time adjusting to these changes with the seasons. And then, you know, we're going to talk a little bit more in depth about vitamin D in a few minutes, but when there's less sunlight, there's less exposure to make vitamin D. There's also less going outside in the winter to be exposed to sunlight to get vitamin D. And there have been links, we'll talk about this more, about low vitamin D and seasonal mood changes. And so I want to just say, like, we know that why this is happening, but it manifests a lot like other mood disorders and changes that a lot of people can experience, like depression. So sadness, irritability, fatigue, sleeping more. Specifically in this winter, fall, people do crave more carbohydrates, refined carbohydrates and chocolate and sugars, subsequently get weight gain. It's unclear if that's due to more of the refined carbohydrates or also probably combination of less activity as well. And that's kind of difficult because this time of year there tends to be more of those types of foods around. So, and you know, while it is something that usually has a finite time frame, it starts around this time and ends at the end of winter, it can be kind of masked by other disorders, and the severity can range. And so it's always best as practitioners to be aware of that severity. So people can have seasonal affective changes that do manifest with suicidal thoughts, self-harm, and things like that. So if that is something that is picked up during a visit, it really needs to be addressed with the importance and seriousness of that. So, and then it does, like I mentioned on the note, it does tend to affect women more than men. I actually, Eric brought this up earlier, I couldn't find any documentation about the physiological changes, why that might happen. And I'll look into this more, but it seems like the frequency has to do with, doing questionnaires through patients. And I think women tend to go to the doctor more and present with these, and, tell their physicians that they're having this type of issue. So that might just overcompensate for the amount of women that are telling their practitioners they have this issue. But I'll look into that more. It's a good point. And so the ages are actually generally between 18 and 30. However, I've seen people in older or younger also have these changes going on. And we're not going to get into this because it's not timely, but you can have seasonal affective changes that happen in the summer as well. Not as common, but it is documented. So we're going to start talking about some of the foundational products that can help support mood and why they help support mood, and potentially specifically in this time of year. And here's just a list of the ones we're going to go over. So first, let's talk about vitamin D. Vitamin D is great. Everyone loves vitamin D. And in the winter, well, I should back up. We all know that vitamin D gets produced in the body after exposure to sunlight, specifically UVB radiation, and then it gets converted in different metabolic pathways through the liver and the kidney and becomes the active form of vitamin D. And so in the winter, you are not A, physically outside as much, and B, the angle of the sun and how much sunlight there is doesn't allow as much of that UVB rays to get through the ozone layer. And I read in one of the papers that I referenced at the end, and I thought this was interesting personally because I am very close to Boston. I will read this quote. It says, quote, "For example, in Boston at 42 degrees north latitude, essentially no vitamin D3 can be produced in the skin from November through February." So if you're a practitioner in the area around like where I am or in the northern latitudes, it's always good to check in on your patient's vitamin D levels. And while there's a lot of studies that show that people who have seasonal affective disorder or people who have depression or other mood disorders tend to have low vitamin D, serum vitamin D, the actual studies on using it as an intervention are mixed. However, we do know that vitamin D has a lot of health implications. So supporting someone to have optimal vitamin D level is, a good foundation. It is one of the things that conventionally you think of when someone has seasonal mood changes, checking their vitamin D and supplementing appropriately. So one thing is that, checking the level is important because when you do supplement with vitamin D3, you can get hypervitaminosis, too much vitamin D. And so that can cause other issues like high calcium. So it's always best to check serum vitamin D levels and then adjust the dosing as needed. And kind of going back to the first couple slides I mentioned, that serotonin transporter, there's actually been research that shows that optimal vitamin D levels in the body repress that serotonin transporter. So that's another reason why optimizing vitamin D can support the other neurotransmitters in the brain to support mood. So going into vitamin D kind of dosing and products. Dosing, like I said, is based on the amount of serum 25-hydroxy vitamin D that a person has. You want it to be above 30. Generally 40 is optimal, above 40 to 50. So a lot of people in my area tend to have levels in the teens. So dosing is dependent on that. I usually do 1 to 2,000 IUs per serving, just because that is easier to go up and down dependent on their needs. Oftentimes people are dosed higher in vitamin D during the winter time to offset that lack of exposure, and then kind of decrease dose during the summer when people might be outside more, getting more actual exposure. Since vitamin D3 is a fat-soluble vitamin, you do want to take that with food or a fat source to help with absorb. I have not seen any difference both clinically and in the research between liquid or capsules, but that is generally a personal or practitioner preference. A lot of times, sometimes I'll tell people to take the liquid if they're feeling a little bit of a pill fatigue, like they have a lot of other capsules that they might be taking. The one thing I will say about the liquid is that it's very good to be clear with your patients about dropper, like the actual full amount that's in that dropper in the bottle versus a single drop. And a lot of times the serving is based on drop, not dropper. So if they did a whole dropper, they might get way too much vitamin D than would be appropriate. So always something to discuss with patients when you recommend a product. So, and then if someone is needing more bone support or cardiovascular support, you can consider one of the many products that is a combination of vitamin D and vitamin K, or vitamin K2 specifically, because we know that those vitamins are synergistic and can have a lot of other health benefits in terms of heart and bones. And I did not list them here, I'm sorry, but there are vitamin D products that are vegan. Vitamin D in products is usually derived from lanolin, which is from sheep's wool, so it's not considered vegan. There are vitamin D products that are vegan and derived from lichen, and they tend to be in that 1 to 2,000 IU dosing. So, and I've seen them work just as well in terms of optimizing vitamin D levels in patients. So the next one is omega-3 fatty acids. So as we know, omega-3s are the polyunsaturated fatty acids that are predominant in the brain and central nervous system. And this is interesting. There's a lot of research that shows that people who have both seasonal mood changes and in general mood disorders have low both serum omega-3 content as well as dietary intake of omega-3s. They just have low amounts of this. And that has been correlated with low mood and mood disorders. However, the research which uses omega-3s as an intervention, there's been some conflicting, results in that area. However, because omega-3s have such wide, vast health benefits, it's a good foundational support. A lot of people do tend to eat differently in the wintertime and tend to eat some of those more kind of refined foods and rich foods and things that may not be as predominant in omega-3 content. So supporting people by giving them an additional omega-3 product can be helpful for their mood. And one interesting fact that I came across while I was doing research is the fact that one of the hypotheses as to why omega-3s do benefit mood so much is due to the endocannabinoid system, which is could be a whole other talk about the cannabinoid system in the body. But endocannabinoids are actually derived from omega-6 and omega-3 polyunsaturated fatty acid precursors. And so they think that having adequate amounts of those omega-3 fatty acids in the system can support the endocannabinoid system. Endocannabinoids, I should say, are not the same thing as phytocannabinoids, but the things like hemp oil, but phytocannabinoids can work within the endocannabinoid system in the body. So I just thought that was very interesting. In terms of dosing omega-3s, generally around 1,000 total omega-3 fatty acids, that's EPA and DHA together, is a good daily dose. Sometimes going up to 2,000 to 3,000 IU or milligrams per day is appropriate if someone also has more inflammatory conditions or is really lacking omega-3s. I usually personally recommend liquids to patients because ultimately it's more bang for your buck, so to speak. You can get higher milligram amounts in a smaller physical serving size, as opposed to taking some of the larger capsules and multiple capsules, but again, really is patient or practitioner preference. And again, I'm so sorry I didn't put the vegan options, but there are vegan options made from algae or plants. And the one thing I will say is that the algae options of omegas tend to be lower potency, lower milligram amount per serving. So you would have to physically take more of those capsules to reach 1,000+ milligrams of omega-3 fatty acids. I did not come across any specific studies on the algae source for omega-3s in mood, but they're probably out there. I will look for them now after this talk. But I've seen them still benefit the wide range of, skin and, mood or attention, things like that, that omega-3s are known to support. So omega-3s are another one that you really should think about during this time of year, especially for those who are getting that downshift in mood. So the next area is a huge one, both huge in terms of vastness, but also in terms of trendiness and kind of point. It's a very hot topic right now, is the microbiome and how that affects lots of systems in the body. I will say, while we know, and pretty much like all the scientific community is pretty much on board with the fact that there is a gut-brain axis, and we know that the bacteria in the body influences the mood and the nervous system and neurotransmitters and hormones. The reason that happens or the mechanism by which that happens is still unknown. I'm sure that it will be uncovered probably in the next decade, I would say, because the amount of information that's coming out on the microbiome every day is astonishing and very fascinating. In terms of the microbiome and mood, I have seen a lot of the studies are done in animals, so it's hard to extrapolate that to humans, but I just wanted to, touch point on a couple studies in animals because I think they're so fascinating. There was one that looked at mice who received an antibiotic treatment, and after they received the antibiotic treatment, they were able to establish that these mice had a dysbiosis. They had an imbalance in the beneficial flora. And then once that dysbiosis was established, those mice ended up starting behaving with depressive and anxiety type traits and behaviors. And then once those mice were given a probiotic and reestablished the beneficial bacteria, the behaviors of depression and anxiety were resolved. So basically, by manipulating the bacteria in the intestine of these mice, their behavior and mood type, signs changed. And then the second kind of mouse study that I found was really fascinating was one where they took two groups of what are called germ-free mice. And germ-free mice are bred to not have any bacteria in their intestine, or very, very little. And they use these for a lot of microbiome type experiments. And they essentially did a fecal microbiota transplant to the mouse from a human who had major depressive disorder. And one group of mice got the major depressive disorder bacteria, and another group of mice got normal bacteria from humans that were not experiencing any mood disorders. And what they found was that when the mice received the bacteria from those who had depression, those mice started exhibiting signs of depression and anxiety in their behavior. So very fascinating that they can enact those, or those changes in behavior can come from changes in bacteria in the intestine. However, and like I mentioned, there's not really a consensus on what specific bacteria is the culprit behind these mood changes. There was a recent systemic review, which I reference at the end of this presentation, that looked at all the human studies, or not all, but quite a few of the human studies comparing those with depression and not, and their microbiome, and kind of saying, what is the change that's between them that might be linking the depression, to, or how you could make a correlation between which type of bacteria and mood changes. And ultimately, well, they did find that between controls and between those who had mood changes, that there was a lot of differences in the main groups of bacteria. There was not a consensus about which taxa were the most relevant to mood changes. So to be determined probably in the next few years. However, I will say that this product that I am showing here on the screen called Target GBX. Target GBX is by Claire, and that actually has specific strains of bacteria that have been studied in humans to work on the gut-brain axis and promote changes in mood. And there was a study that used it. It was a pretty small study, but it was still a human study. And they found that taking that specific blend of specific strains of probiotics showed a reduced overall reactivity to sad mood, less aggression and ruminating thoughts. They addressed this by doing different questionnaires. And they, had an easier time getting out of sad moods. And they also did mouse studies with this blend as well, and they found that it improved the mice symptoms of depression and anxiety as well. I have personally used this in a lot of my patients, specifically those who have functional digestive disorders that seem to cause a lot of anxiety as well. Like a lot of people who have digestive disorders tend to have a lot of mood changes as well. Chicken and an egg, it's not really clear what comes first, but I find that this one is really supportive for a lot of people. And my colleague Lisa Murray has also utilized it and found the same results, kind of calming sensation. And now that we know that diet also plays a role in which type of bacteria are most prevalent, and this time of year, people tend to eat differently. That can change the bacteria. We know that dietary changes can change the microflora within only a couple days. So something to support people through this time of year is thinking of studied strains that we know can support both the beneficial flora and then also the gut-brain axis. So, and again, there's a lot of interesting references at the end if you want to get more in depth on the science. So now we'll talk a little bit about the herbs that are used to support mood. The first one is probably the most well-known for mood support, and that's St. Johnswort or Hypericum. This one has been studied for many years because it's traditionally been used probably the longest, generally for mild to moderate severity in terms of mood. It has been studied for winter mood changes. The studies were actually done with phototherapy or light box therapy, which we'll talk about in a minute. And they showed that, adding the St. Johnswort can be supportive for that specific therapy. Even without seasonal changes, St. Johnswort has a lot of supporting studies showing that it can improve mood. The biggest kind of takeaway from St. Johnswort is that it has to be used appropriately because it does have a lot of potential side effects specifically in terms of interactions with other medications. St. Johnswort can work sort of similarly mechanism-wise to an SSRI or a selective serotonin reuptake inhibitor. So if you're also taking other medications that can cause that, leaving more serotonin around, then it potentially could theoretically cause serotonin syndrome, where you have too much serotonin in the system. It also potentially could disrupt the metabolism of other types of medications in terms of how those medications are broken down or how effective they would be. So St. Johnswort, probably of most herbs, is the one that has the most caveats or potential drug herb nutrient interactions. So always best to check on that before recommending this or any herb to someone who's on a pharmaceutical medication. The other aspect about St. Johnswort to pay attention to is photosensitivity, and which is interesting because they used it in a lot of studies with light box therapy, but as we'll talk about, light box therapy doesn't have UV. But So just be careful. A lot of people, at least in my area of the world, tend to go to sunnier, warmer climates during the winter. And so if they're on St. Johnswort, just caution them to use appropriate sun protection, or try to avoid direct sunlight if possible, or other medications that could also cause photosensitivity. There's quite a few. So in terms of dosing for St. Johnswort, it's usually the studied dose for supporting mood is 300 milligrams 3 times a day for at least 4 to 6 weeks. Generally up to 12 weeks is usually the time frame where one would use St. Johnswort. If someone hasn't seen any positive changes by that 8 to 12 weeks, it might be some time to consider potentially switching treatments or adjusting. And with St. Johnswort, unlike some of the other medications out there that can adjust mood, there's not an issue with stopping it abruptly. You don't have to taper to stop it. So then the next one, the actual ingredient is called Celexin, but the product is called Lavella. And that is a concentrated lavender essential oil. And I really like this product for a lot of my patients. It is specifically for helping with that feeling of anxiousness. And there's actually a lot of human research studies that have shown its benefit. There was actually a meta-analysis that came out in the last year, I think, that showed that it had this particular ingredient had statistically significant and clinically meaningful anxiolytic effects for kind of mild to moderate symptoms of anxiousness, and also helped with secondary sleep issues. And people who were taking it also just reported an overall improvement in quality of life. So it's well tolerated. Like St. Johnswort, and unlike other kind of interventions, it can be stopped without any need to taper, which is nice. The one thing is it does take at least a month to usually see a benefit from it, so people have to take it consistently. There have been a couple studies which showed that the dose is generally 1 tablet or capsule. If you increase it to 2 capsules, it can help with the more depression as well. So sometimes if people have kind of a low level feeling of anxiousness throughout the year, we might increase the dose to 2 during this time of year to kind of help address some of the extra stress that might come along. The one thing I will say in terms of side effects, excuse me, for this particular product is it is a gel cap, and like fish oil products, which sometimes quote unquote repeat on you, this particular product can cause burping that tastes like lavender. So not the worst side effect. It is slightly strange. I did try it myself to see if that actually happened, and it does. I've never had a patient complain about it. Actually, I've had one person that just did not like that flavor, but for most people, it was not a problem. So, but overall, it's very well tolerated, and that's one that I've seen work really well for people in clinical practice. And then the other one I wanted to mention is curcumin, because curcumin is also a very popular, very hot topic ingredient, and it gets a lot of attention for its anti-inflammatory and kind of joint support, general activity, which it's great at, but it also has a lot of studies to support mood, specifically low mood. And there was actually a review of it, and it showed that taking 500 milligrams of curcumin twice daily did improve mood over the course of 4 to 6 weeks, more than placebo. And they actually was one study in particular that compared just curcumin with curcumin plus saffron, and the curcumin plus saffron was slightly better than just curcumin, but they both showed improvement. So a lot of people might be using curcumin already as part of a foundational support, in which case potentially adjusting the dose, or just knowing that curcumin can also support mood. That's the one thing I really love about natural medicine, is that a lot of the herbs and ingredients have multiple beneficial effects. So you can choose something that has like the most action that you'd like to take with a patient. So curcumin is just something I wanted to bring up because I want people to think about it as something that can support mood. And the mood systems balance product that I show here on the screen, that is the product I could find that combines curcumin with saffron, and specifically the type of those ingredients that were used in the study. And I link the study at the end. So curcumin for mood. And then the last kind of general area that I wanted to talk about, which I didn't go into too much detail on just because it could be its own talk, is supporting the stress response and the HPA axis, the hypothalamus pituitary axis or adrenal axis, and using adaptogens to support that, because that can definitely impact mood and neurotransmitters. And this time of year, like Eric mentioned before, there's a lot of stressors that can impact people's lives. And just really talking to patients about how they are feeling stress-wise and what they can do, and then utilizing one of the myriad of adaptogen herbs or nutrients that exist to support them. A lot of practitioners have their favorites. I personally like ashwagandha. I like cordyceps and lots of mushrooms and magnolia. So there's a lot of different stress support products that are out there. So that is definitely something that we know can support mood, and specifically this time of year. And if you have questions about specific products or formulations of stress support, feel free to ask here or send me a question through Ask the Expert, and I can help you out. So in terms of supporting the whole person and kind of how to integrate other aspects of care into someone who's having winter mood shifts, one thing to consider is light therapy or light box therapy, which is considered one of the first line treatments for seasonal mood shifts. And it's specifically designed to help support that, diminishing. It's intended to diminish the melatonin that's still in your system in the morning because it's so dark, because you want your retina to note that there's light and therefore increase that cortisol that's supposed to rise in the morning. And not it's not like using a normal table lamp. You need a specific light that produces a full spectrum of light waves without UVs, and they specifically make these. Generally, the therapeutic dose is around 5,000 to 10,000 lux is the unit, and you don't have to use it for very long. It's generally about 15 to 20 minutes, generally in the morning when it's still dark and you're trying to wake up and kind of reset that daily circadian clock. And you do not look directly at it. I'm actually sitting next to mine at my desk right now. It's not on, but you generally put it someplace where a person in the morning will sit down and have their tea or their coffee or check their email, whatever they're doing in the morning, where they're sitting quietly, and just have it on about 1 to 2 feet away at an angle, so not directly in their vision. And that has been shown to be as effective as therapy for people who have seasonal mood shifts. So if people are feeling these low mood in the winter, and especially the darkness is really a problem for them, they can consider this. It is meant to be used with the care of a practitioner. It is not to be used with photosensitizing medications, even though there is no UV. It still can potentially cause that issue. So just caution patients on that. And then also be cautious with people who have diagnosed conditions like bipolar, because there have been documentation that the light therapy can instigate a manic episode. I'm not entirely sure the mechanism of that, but that is in all of the light box therapy kind of recommendations. Just be cautious of that. They're pretty accessible now online, and so patients can try that before they try other types of intervention if they wanted to do that. And then other, these are all, the rest of them are kind of ones specific to mood support in general or general health, but it's worth noting exercise obviously supports mood. been very well documented in research. It's hard in the winter, but there are a lot of online videos now that people can move in their house. It's free. This image on the slide is of a lady running in the winter, which is not something I do, but I am very impressed by those who do. But doing something that the person enjoys and talking to them about how to implement that into their day-to-day life can be really helpful for mood support, even if they're not feeling up for it, which is when the light box comes in and helps people feel more awake in the morning to maybe move their body. Counseling. Counseling is an incredible tool for any health issue, specifically mood issues and specifically seasonal affective mood issues. I always sort of joke with my patients, but I'm not really joking, is that I wish that foundational healthcare involved a counselor, like a trained counselor and a body worker of some sort. I always tell patients, like, you can have a therapist and like an acupuncturist or a body, like a massage therapist, craniosacral, whatever sounds best to you. I feel like that would make a lot of improvements in health overall. But counseling can help. Those people can offer guidance for how to deal with some of the kind of overwhelming sensations and emotions that come up during the winter. And then, as we talked about, during the winter, diets can shift. There's not as much fruit and vegetables, fresh fruits and vegetables available locally for most people, but still kind of helping people focus on that kind of whole foods, lots of plants, as much of those brightly colored fruits and vegetables as they can get. Frozen fruits and vegetables are fine. Making soups, making even like hot fruit kind of bake desserts just to get more different antioxidants in their system. Those are going to be really helpful as opposed to just eating a lot of the cookies and cakes that tend to be around. And having a balance is good too, just not overdoing it. And then sleep hygiene. We know that the melatonin is going to be a little bit more pronounced during the winter because it's so dark, but trying to get people to have that standard wake time and sleep time can be really helpful for just keeping that circadian clock as efficient as possible and not allowing them to feel so fatigued. I'm putting sunrise alarm clock on this because it's something that I find very helpful. I actually started using one last year for the first time. And basically what it does is just lights the room up slowly for about 30 minutes prior to the actual time you want to wake up. So if I want to wake up at 5:45, starting at 5:15, it's going to slowly make the room really bright so that when your alarm goes off, you're not jarred into a dark room. They do make really expensive ones. I, full disclosure, bought the cheapest one I could find, and it works just great. And so I've had a couple patients adopt that, and they also find it helpful to just get going more easily in the morning. And then teas, I really like to recommend teas in protocols for patients a lot because it kind of, again, gets away from kind of taking a lot of capsules or pills that sometimes gets a little overwhelming for people. Also, tea can be a good ritual. It can be warming. It can be a good way to wind down during the day or take time for themselves. And I mentioned one herb here that I really love for this is Tulsi, which is also called holy basil. And this, with herbs, we think of their actual biochemical actions and their constituents, but we also consider their general kind of characteristic. And Tulsi is an uplifting herb. It is, it's energizing but not caffeinated. It's interesting because it can calm people down, but it gives people more of like a oomph to their day. I feel it motivates people and gives them a little bit of a hug almost. It kind of lifts them up. So I love Tulsi during the winter to kind of give people that motivation if they feel a little bit down. And I didn't put it here, but ginger is a really great winter one because it's very warming. People tend to feel a little bit down and closed in when their shoulders are hunched and they're cold. So kind of giving something to warm them up can be really helpful. Okay, so then talking about just general things to consider. When talking to someone about mood issues, I tend to ask people if they have seasonal mood changes on my questionnaire, probably because I live in New Hampshire and it's a very real thing that people go through, but trying to validate their experience, understand that, it is a real condition that they're going through, and that you can explain why it's happening and you can give support, and that it does have hopefully an end time, and you can do as much as you can to support them through that. Definitely discussing prevention, which is why I kind of ask people, like, is this a trend for you historically? Do you tend to get low mood or tired or have changes in energy throughout the seasons? And kind of working on ways to implement a protocol. So whether it's scheduling a counseling appointment or signing up for an exercise class or starting, like here, starting the products or protocol in the late summer, early fall, so that they're in the system, the body, for enough time when the middle of winter happens and those people start feeling really sad and down. Always check drug nutrient interactions. That is very important for any situation, not just St. Johnswort, but there are a lot of herbs that can influence cytochrome pathways, which is how drugs are metabolized. And so combining them can affect the action of both the drug and the herb. So always do that. Drinking some water. Definitely using a team-based approach is helpful for any clinical condition. If someone is coming in and they are having a really bad bout of like depression in the winter, and it seems really severe and it seems out of your scope or out of your experience, definitely refer to someone and have those relationships that you can refer someone to make sure that the patient is getting the best overall care that they need. And then, just remembering that occasionally medications are appropriate. Sometimes in the therapeutic order of kind of determining where the necessary intervention should be, certain people do need pharmaceuticals so that they can get through a really tough time. And the thing about specifically mood medication is that it is really meant to be used for short periods of time. So occasionally some people can use medications if they're having an issue during the winter and are able to taper and come off of it for the rest of the month, and that is fine. It's always good to make sure that the patient works with someone, if you're not that person who utilizes medication, to make sure that they're working with someone who is skilled at that and also skilled with helping them off of it, because that tends to be the trickier part. And then like kind of going into that, refer when necessary, because teams are great. A lot of patients are already working with multiple providers. It's good to have a good network for them. And then check in with the patient. If I have a patient that I know has a hard time in the winter, I'll make a little like virtual sticky note in their chart and just send them a message or give them a call, just check in on how things are going, because it really can kind of boost their morale or just make sure that you can adjust the treatment plan accordingly. And then, as integrative practitioners, you want to think about the whole person and not just focus on the biochemical changes that are happening in their body and how to address them, but kind of thinking of, it's winter. Are they isolated? Do they not have family support? Do they have community? There's not a lot more research now coming out about how loneliness and social isolation can impact health. So making sure you just check in with that patient and seeing what you can do to support them. Other than specifically just thinking, oh, it's the winter, oh, they're tired, we can support them. Think about checking and ruling out if there are nutrient imbalances, such as like B12 or iron or some of the other cofactor elements, minerals that are needed for various neurotransmitter pathways. And endocrine imbalances such as hypothyroidism, which is one of the most common kind of organic causes of depression, is if that is imbalanced, addressing that can really improve mood for someone. And then kind of going back to talking about the person, checking in about like what they can do, what makes them feel joy in life. Do they have hobbies? Can they start, doing some of these hobbies to support their mood throughout the winter? If it's a stressful time, what do they do for stress support and how you can support them in that? And going back to exercise, what ways can they move their body? I recommend people set a timer if they work at a desk, and every 25 minutes get up and walk or move their body for 5 minutes. I try to do this myself. It doesn't always work, but it's better than not moving at all. And then one thing that I want to just remind practitioners about is checking in with patients about substance use. Sometimes that goes unnoticed because patients don't often offer that information unless it's specifically asked. So this time of year, specifically also, alcohol use. Are they drinking more than they usually do? how does that impact their energy and their mood? Because that's definitely going to play a role in mood, and just making sure that they're doing it in an appropriate way. So these are all references. If you have any questions about them, I think Eric might be able to give out my contact, but hopefully these are helpful for you. And so yeah, again, if you're not familiar with Emerson, we are a wholesale distributor of many, many different types of professional products for healthcare practitioners. And we have both the Emerson Ecologic website as well as a patient-facing dispensary that you can use, that patients can purchase their products online. It's called Wellevate. And so hopefully we'll hear from you. So now we'll open it up to questions.
Great. Well, thank you so much, Meredith. That was
Yeah.
really a lot of very practical stuff
Oh,
in
wow.
there.
Sorry, it took a long time.
Can you hear me?
Yes, yes.
Okay. So yeah, really good practical stuff in there. If you out there in webinar land have questions, please type them in the little questions chat box that's on your control panel. You just click open that tab that says questions, and you can type in questions there. I'll kick things off. I was wondering if you have some experience with ginseng, any of the
Oh,
ginseng products. It's promoted as an adaptogen. It's supposed to be fairly energizing. Have you used it clinically?
yeah, ginseng, absolutely. There are, different ginsengs, Korean ginseng and American ginseng. But as an adaptogen, yes, it's energizing for people, also for cognitive support. And so it is a lot. I usually use it within formulas that have other herbs in there, but I don't think of it specifically through the winter per se, but just in mood and energy in general. Definitely ginseng is a good addition to a formula.
Okay, great. So Lisa has a question.
Ah,
She's curious about whether naturopaths do prescribe antidepressants or strictly nutritional supplements.
that's a good question. It depends on the person. It depends on their training. And it depends on where they're located in the United States. So as a licensed naturopathic doctor, when I went to school in Oregon, we are taught both herbal medicine and pharmacology. So we have the ability and training to prescribe certain medications. Pharmaceutical antidepressants are a specific area where I find my colleagues who do use them did a lot of either residency or training on how to use them in a way that kind of more fits with our approach. But people can. In certain states, naturopathic doctors can't prescribe medications at all, in which case you just have to know what your formulary is. But generally, our therapeutic order is to try to use more natural approaches first and the less of aggressive approaches, and then, doing more of the dietarian lifestyle. But if someone does seem like they've exhausted those options and medication might be an option, it's something to talk to their practitioner about.
Great. Okay, actually, same questioner. Lisa wants to know, do you have any experience with a herbal combination called Rasa?
Rasa, how do you spell that? I don't see that on the card.
Rasa. It contains roasted chicory root, cacao, burdock, and dandelion, shatavari,
Ooh.
heifu, a whole bunch of things, Cotinopsis, eleuthero ginseng, ashwagandha, rhodiola.
Oh,
Sounds like
is that yeah, I think that's a coffee alternative, I
yeah,
believe.
I think that's what she's saying.
Yeah.
Yes.
I have not used that clinically, but I've had a couple patients who have used it and really liked it. It's an adaptogen for like almost a drink mix. I believe this is the same thing. And people use it as instead of coffee during the winter. And I think that's great. Yeah, it has a good formula of herbs and is also seems very warming. But I have not personally used it, unfortunately, but now it's on my list.
Well, and as long as we're on the topic of
Mhm.
coffee, what's your take on coffee? Is it generally helpful for people? Um, do you encourage your patients to drink coffee?
Wouldn't say I encourage it, but I don't discourage it unless it depends on the person and the amount. My personal approach is not very like black and white on most topics. I tend to kind of work on that individual person. So if someone is extremely fatigued and it seems like they've drunk 6 cups of coffee a day and that we really need to kind of really support and nourish their adrenal system, I would say take a step back from coffee and try to work on some of the other adaptogen energy supporting herbs. But if people are drinking, a cup of coffee a day and it's not impacting their sleep or their energy, I don't generally have a problem with it. Unless they're like adding a ton of, sugar and it's not really coffee, it's kind of a dessert. Then I would
Right,
say,
right,
step back on that.
right. It's a milkshake, a coffee flavored milkshake.
Yeah, yeah, exactly.
Yeah. Okay, Teresa would like to know, are there any glycerites that are good for mood?
Glycerites. Yeah, there's definitely a lot of tinctures, an alcoholic tincture of an herbal extract can often be made into a glycerite where there's not alcohol extract used, which is really great for both people who are avoiding alcohol, people who have had an alcohol dependency problem who we should not give alcohol-based products to, and well, also sometimes children, depending on the dose of the herb. And I'm just trying to pull up some options for glycerite tinctures. But if you search, I know on the Emerson website, if you search like mood or the specific herb you're looking for, and then you can filter by format and you can filter by glycerite. There is a calming glycerite, I believe it's by Gaia. And I know there's one specifically for kids called I think Kids Calm Glycerite, Calm Support. I'm bad at names, but it is great, and it can be used for adults as well. And it's a combination of nervine herbs, so it has like chamomile and catnip, and just really kind of I think lemon balm, obviously, and it's really calming. So, but yeah, definitely glycerites can be used to support mood for sure.
Great. Okay, Kylie would like to know, can St. John's wort be used in conjunction with other herbs for depression and anxiety, or is it better to take that alone?
That's a good question. It can be used with other herbs. Sometimes there are formulas that combine St. John's wort and other adaptogens or other neurotransmitter support. The studies that are most often used to show that St. John's wort is supportive for mood are St. John's wort alone. So it can be used alone and still have benefits, but there are formulas that contain both that and other herbs. My personal approach oftentimes is to try single herbs first with people to see how they respond to that, and then move into potentially the next, with like if we continue that, maybe switch to a formula that has multiple herbs. Just because if you start out with a combination and someone is really sensitive and they have a response, whether it's positive or negative, you don't really know what they're responding to within that formula. So, but yes, you can include it with the formula.
Great. Okay, do you have any recommendations for reputable lightbox brands?
Ooh, reputable light box fans. I will tell you, the one that I have on my desk is called Verilux, Verilux. Um, and I think I listed it in the references, but there is a article, if you just type in light box or light therapy Mayo Clinic, there's a nice overview of light box therapy, and I believe they actually link to some options. Um, but there are websites that specifically kind of review light box therapy, and then people can sometimes find it on Amazon. And I had a patient who found one that was a really reasonably good one at Costco. So,
I'm wondering,
mhm,
in terms of how people come in, people present, how
mhm,
often, like in your practice experience, how often is it that someone's going to come in and say, gee, Dr. Murray, I'm feeling crummy ever since October. I think I have
mhm.
seasonal affective disorder. Or is it something that's more like of an incidental finding where like you're working them up for something else and then it's an oh by the
Mhm.
way?
Yeah, I think it could be either. Most of the people I see are old enough that they've lived potentially here long enough that they know that it comes. They're like, yeah, I'm pretty good. My energy's fine most of the year. And then once it's like October, November, I'm down for the count until March, in which case then we say, okay. If they come in say in the middle of December and they have low mood and mood issues, I will work them up for other issues like, the nutrient imbalances, endocrine imbalances, and then treat them for mood, and then potentially lighten up on the treatment as we get into spring. And if their symptoms go away, then we know it's more of a seasonal thing. But if their symptoms continue, then we have to consider other diagnoses or other possible causes.
Right.
Yeah.
Okay. And you mentioned in your talk about the hypothyroidism.
Mhm.
Are there other hormonal clues that you look at when you are working these patients up?
Just like testing for other hormones.
Yeah.
Yeah, potentially. It depends on their age and gender and symptoms. Um, but sometimes we'll look at salivary cortisol to see what their actual cortisol curve looks like throughout the day and see if that is, also being really impacted by stress. Occasionally, if it's a female patient, we might look at hormones depending on if she's having other cyclical changes or other signs that point to uh, a sex hormone issue,
Hmm.
and if they're in that age range. But usually thyroid, full thyroid workup, and then potentially cortisol are the main ones I think about.
Mm. I'm just shooting from the hip here.
Mhm.
Do you know if there are any studies or anything anybody's looking at whether seasonal affective shifts improve in women if they go on hormone replacement therapy postmenopausal?
That is a good question. I don't know. I mean, a lot of the research has shown that the women who report seasonal mood changes, it's within 18 to 30. And but
Uh,
then again, perimenopause and menopause comes with its own mood shifts as well. So it's I guess it would be trying to figure out, is there a worsening during these winter months? What else can we do during the winter months? And then depending on how long it's lasting or what other signs and symptoms we see clinically, hormone or perimenopausal support as needed.
mm,
But yeah, I'll look into that because that's interesting.
yeah, and while we're on the gender question of gender, so it disproportionately affects women,
Mm-hmm.
but it does affect men. Do you find that
Yep.
there are particular treatments that tend to work better in women versus men, or men versus women, or any
Hmm.
gender difference with regard to treatment approach?
I personally have not seen that clinically, and I did not come across that in when looking into the research on it. I'm trying to think if I mean there's been documentation, and I have also seen clinically sometimes men are less open to doing counseling sometimes, but not always.
Mhm.
And so doing more other interventions before counseling might be helpful for them. But that's just my experience. There's a lot of men in counseling, obviously. But no, I haven't seen any specific, sex differences in treatments.
Okay. Sherry would like to know, what about rhodiola? Nice.
Yeah, rhodiola is a great mood support herb. One thing about rhodiola that I've seen that is documented in some conditions is that for some people with anxiety, sometimes rhodiola can exacerbate anxiety, and occasionally, not everybody. So if someone comes to me and they have more feelings of anxiousness, I might either avoid rhodiola at first or use a formula that has lower amounts of rhodiola and just see how they tolerate it. But rhodiola can also there's been documentations that it helps with feelings of anxiety and stress. So it's kind of a trial, but it is it is a lovely mood support herb. I haven't seen any documentation with that specifically in seasonal mood shifts, but in general, it is a nice one.
Great. Okay, and what recommendations do you have for someone who has IBS and difficulty sleeping?
Hmm.
The issue here is when there's absorption issues, the intestine is compromised and they may not be absorbing a lot of the things that you're trying to put in.
Yeah. Um, I would actually really consider that Target GBX product because that one not only I didn't really talk about this as much, but not only does it affect the gut-brain axis, it actually has a lot of probiotic strains that have been studied to support the intestinal lining. and to support the integrity of that intestinal lining, which is often compromised in those who have IBS or have a lot of sensitivities or have had other dysbiosis. So there's a lot of research on certain specific strains that help repair that alongside other nutrients. So I generally follow that, kind of remove the offending situation. So if there's, a bacterial imbalance or an infection or a parasite, kind of remove that and then kind of replenish with bacteria and if they necessary enzymes, and then nutrients like glutamine and some of the other mucilaginous herbs and probiotics that kind of help strengthen that lining. And then occasionally, like specifically with sleep, if depends on their symptoms, if they're having IBS, if they're having a lot of diarrhea and that's keeping them up, there are certain nutrients. Serum bovine immunoglobulin comes to mind. That one helps with intestinal lining and supports the integrity as well as diminishes frequency of bowel movements, and so sometimes that can be helpful. I hope that answered the question. That's a big question. There's a lot of other questions that come into my mind.
Yeah. Well, we're a little bit over time, but I think we can take two more quick questions if anybody's got one.
Sure.
But I think that was a really good overview, and I appreciate all the practical, clinical pearl kind of stuff, because when it comes down to it, it's like, what's going to work in this patient in my office right now?
Yeah. Yeah, and I was hoping that, a lot of these, probiotics, fish oil, vitamin D are all things that a lot of people use as foundational, and just knowing that they are really good tools for mood can be helpful to know that, they have multiple actions.
I'm just curious, since you sort of touched on it in the talk. So are you finding that a lot of patients are already self-medicating with CBD as something to try on their own?
I have a few patients. It is a pretty kind of gray area in terms of supplements and CBD. I know that marketing the CBD content is not really encouraged and everything, but in terms of supporting the endocannabinoid system, I think that is definitely worth trying. And I wouldn't say a lot of my patients are on CBD, but some people are and they do really like it. And I don't, if they're doing fine on it, I'll make sure that it's a good quality one and they can continue it.
Great. Okay, last call. Any last minute questions for Dr. Murray before we sign off? Well, it looks like we covered it.
Okay, well, thank you so much.
Yeah, thank you, Meredith, and thank you all for joining us this evening. We did record the session, so you'll be getting a reminder about the recording in a day or so. So watch for that if you do want to replay this. And if you haven't downloaded the handout, it is in there under the handouts tab. So just open that and click on it. And you can download Dr. Murray's slides right onto your computer. And that about wraps things up for this series of webinars on fall and winter support essentials. And I want to thank our sponsor, Emerson Ecologics, and our three great educators, Dr. Murray tonight and Dr. Lisa Murray led off a couple of weeks ago. And then we had Jacqueline Chassis sandwiched in between. So it was a really great series, and stay tuned for more webinars from Holistic Primary Care. We got a few things coming up later this fall and into the winter. And in the meantime, have a great fall season, beautiful Halloween, and we look forward to your joining us for future webinars. Thanks very much.
Thanks. Bye.
Bye-bye.